In this segment, I want to talk to you about your day of surgery, what to expect, what you need to do, and just the preparations for that day. So in the book, you'll look, and I have a section there with things that you can bring on your day of surgery. One thing I want to tell you is that we're really big on safety here. So you're going to be put in a yellow gown while you're on the floor that's going to identify you as a high fall risk. You'll have a yellow wristband, you'll have yellow socks on that have rubber on the bottom of them that you can walk in that are non-slip. But I want to give you the option of bringing things with you that would make you more comfortable in this environment and make you feel more confident. So things that you can bring with you. You can bring shorts or long pants. The things I asked about those things is make sure that if you bring either of them, that they're elastic bands and they're loose fitting so that we can get to your incision site should you have a problem while you're out ambulating in our hallways. Think about bringing your toothbrush, your deodorant, those personal items that you are more confident with at home. We do provide some basic necessities. If you want to bring your own, you can bring your own. We can provide those to you. We don't have a hairbrush, we will give you a comb. So that should be an option that you can think about. Hair dryers, we can provide you with a hair dryer here at the hospital if you need one. Just make sure if you want to bring, you can bring your computer, a laptop, a tablet, whatever you want to bring with you. I just do reiterate that if you bring those items with you, Colquitt Regional is not going to be responsible for them should they get lost or broken. But you can bring them. We do have Wi-Fi connection where you can connect to the Wi-Fi and be able to do whatever you do at home and be comfortable here. So on the day that you come in, so I'll talk to you now about our goals. So our goals are to get you out of here as quickly as possible, but as safely as possible. So the goal to get you home, whether you have a knee or a hip surgery, is to get you home within 48 hours of your surgery. Each patient is going to be individually assessed for safety and for their ability to be able to be successful going home. So it will vary from days on day 1, day 2, day 3. We do look at the success rate of the patient, how the patient feels, their eagerness to participate and their eagerness to learn. We have had patients that have been going home post-op day 1 with both a hip and a knee. So that is an option if you come in and we get you up on post-op day 0. We can get you moving, get you ambulating in the hallways the next day, and get you navigating some staircases and just prepared to be safe going home. If the doctor feels like you've met those requirements, then we can possibly get you home on day 1. Most everybody needs to come in with a goal of going home in 48 hours. And we'll say that if you have to go to a rehab facility, you'll probably be here 72 hours before you go to the rehab facility. So we're going to get you up on day 0 once you get to the floor. That's our primary goal, to get you out of bed that afternoon. So hopefully your surgery will be done by 2:30. We get you up to the floor, can get you up and get you moving on day 0. So that morning when you come in, you're going to go down to the registration desk where you come in and done your registration for your pre-op. Once you're there, they're going to get you registered in, and you'll go into our surgical day center where you'll have a room that's private for you to get prepared in. You'll get changed, and you'll be. They'll start an IV on you. They're going to come in. They're going to ask you a lot of questions, do your admission assessment for your surgery. Just talk. They're going to ask you plenty of questions. Make sure nothing's changed since your pre-op appointment, and an opportunity there for you to be for your safety is. They're going to ask you to come in and tell them what procedure you're having done. So if you're, they're not going to walk in and say, so you're having a left hip or a left knee. They're going to come in and ask you, tell us what procedure you have done. That way you have the opportunity to say I'm having a left hip or a left knee. That way we know that we're doing the right thing. You know what we're supposed to be doing, and we're going to mark that site at that point before you go to surgery to make sure that we do right surgery on the right side. Another opportunity for safety will be once you go into the operating room, they'll do what they call a timeout before your procedure. And in that timeout, they're going to verify your name, your medical record number, and your information as to why you're here. They're going to make sure that everything's ready to go before they put you to sleep and do your surgery. So once you have your surgery, you'll wake up. Most likely you'll be in our post-anesthesia care unit when you start waking up, and you'll go to the post-anesthesia care unit for about an hour at the minimum, and then maybe up to 2 hours. Your surgery typically is going to take somewhere between 2 to 2.5 hours from the time you go in the operating room to the time you go to the post-anesthesia care. Once you're in post-anesthesia care, we're just going to make sure that you're good and awake enough that your airway's maintained, your breathing's fine, your vital signs are good, and that you're not having any complications before we bring you to the floor. So the family should expect 3.5 to 4 hours from the time you go into the operating room to the time you get to the floor to your room. Now, once you get up to your room, you're gonna be in a private room. You should be on 5th floor. It is our surgical floor. Is where I work. You'll see me and you'll see my staff. One of our goals, like I talked about earlier, was if you get to the floor by 2:30, 3 o'clock, we're going to try to get you up with physical therapy that afternoon. That's really a goal that we've set recently, and we're trying to improve on that. It's shown to improve the outcome and the length of stay. So we want you to be prepared, and we want you to be eager to participate once you get to the floor, and know that your expectations should be that we're going to be getting you up. One thing I want to tell you, once you get up to the floor, the biggest obstacle most patients have with getting out of bed that first time is that there's an unknown. You really have people will question whether or not that knee or that hip is going to be stable and whether they can get up and do it. I will tell you 100% of the time that knee or that hip is stable. So when you stand up and you put pressure on it, it's not going anywhere. It may hurt a little bit, but it's not going anywhere. And once you're able to get up and bear weight on that joint and see that it's not going to be a problem to be able to put weight on it, your confidence level will go up. So the quicker we get you up, the quicker we get you moving on it, the more your confidence will build, and the more eager you should be to participate in your care and your recovery.